So what is happening in the normal sinus rhythm? So this is a normal jugular venous pulse or jugular venous pressure wave. So we have an A wave, C wave, and a V wave, which are positive waves, and there are two negative waves, which are X descent and Y descent. So look at it now. You don't need to have a very good understanding of this each and every part. If you remember this simple mnemonic for the remembrance of what wave corresponds to what event in the cardiac cycle. A for A stands for atrial contraction. Okay, A wave is seen in atrial contraction or atrial systole. X wave is seen in atrial relaxation. X wave is seen in atrial relaxation. And then the C wave, C for cusp or C for closure. So C wave corresponds to the closure of the tricuspid valve. But what happens after the closure of the tricuspid valve? The phase of the cardiac cycle, which is isovolumetric ventricular contraction. Then followed by the V wave, V for V, ventricular contraction, or you can also remember venous filling of the atrium. Okay, V for we are the ventricular contraction is we are not concerned about the ventricular contraction here, because whatever we speak about, we are talking about the atrial pressure changes, right? And then lastly, we have the Y wave or the Y descent, which corresponds to the atrial emptying. There is a Y in empty and there is a X in relaxation. That is why you can understand it as atrial relaxation, that is an X wave, and atrial emptying for Y wave.